Welcome to the Wayne Lamos podcast. I'm your host Wayne Lamos, and we are continuing with a mini-series Understanding and Not Judging the Angry Man. This is episode 2, Understanding different types of anger for the common man. Here we will first look at the different types of anger as mentioned by therapists in general, and then we're going to understand a bit of 4 different anger disorders mentioned in the DSM-5. DSM-5 standing for Diagnostic Statistical Manual of Mental Disorders. Here we're looking at 10 different angers, which is the most commonly used. The first being assertive, second behavioral, third chronic, fourth judgmental, fifth overwhelmed, sixth passive aggressive, seventh regulatory, eighth self-abusive, ninth verbal, and 10th volatile. Assertive anger is a positive, constructive manner of expressing anger where you apply your feelings of frustration towards a more positive change. It is this type of anger which is taught to people in some anger management programs, which may include substance abuse. Moving on, the second type of anger is behavioral anger. It is usually overwhelming and it could be aggressive and expressed physically. The third type of anger is chronic anger. Chronic meaning persistent. Chronic anger is over a period of time and it could be resentment for self, or of a person, or of a situation or circumstance. The next is judgmental anger. It is a reactive anger to a situation one may perceive as unfair or as unjust. After that is overwhelmed anger, when a situation or circumstance is out of your control and you feel frustration or as you are unable to do anything about it. Moving on is passive aggressive anger, which could involve suppression or repression. Suppression being, I don't want to talk about it. Repression being, I'm fine. This anger is an avoidant type of anger which avoids confrontation. The next is retaliatory anger. This is a reactive anger and is experienced when a person perceives a confrontation or a threat by another person. It is the most common type of anger. After that, we have self-abusive anger. Here, situations may bring about emotions of humiliation, shame, inferiority, and the anger is vented internally. It includes negative self-talk and eating disabilities also besides self-harm. Next we have verbal anger. This anger is usually targeted at a person or an object who becomes the victim of shouting, blame, ridicule and sarcasm. And lastly you have volatile anger. Volatile anger is where something annoys a person and they vent their frustration about what's annoying them and then they calm down just as quickly as they got upset. Volatile anger is actually more common in males than it is in females, and it has been linked to substance abuse. Now that we understood the 10 different types of anger, let us take a look at anger disorders as mentioned in the DSM. We are looking at 4 over here. The first is intermittent explosive anger, second borderline personality rage, the third is DMDD, that is disruptive mood dysregulation disorder, and ODD, that's oppositional defiant disorder. So we start off with intermittent explosive disorder. So in order to understand that, we have to look first at white matter and gray matter. Gray matter is involved in the control of memory, emotions and movement. White matter acts as a relay coordinating between different brain regions. Okay, so in intermittent explosive disorder, here neuroimaging has shown that there are deficits in gray matter as well as dysfunction in the insula of individuals with intermittent explosive disorder. These individuals also displayed a stronger amygdala response to angry faces. It has been suggested that there could be a degeneration of white matter tracts in people with IED. People with IED may overreact as compared to a normal person to any situation, with angry outbursts and even violent behavior. People with IED could even be involved in road rage and domestic abuse and throwing and breaking of objects. Treatments include psychiatric medication and psychotherapy to help them control their aggressive impulses. The second anger disorder we are going to be looking at is borderline personality rage. Over here, neuroimaging points to certain areas of the brain, namely the anterior cingulate cortex, involved in empathy, impulse control, emotion and decision making, the orbitofrontal cortex, whose role in emotional behaviors is reward value, the dorsolateral prefrontal cortex, involved in conflict management, mood regulation, novelty detection, and decision making, the hippocampus, whose role is in memory, and the amygdala, involved in detection of a threat and activation of appropriate behaviors. Here, an important point to underline is that people that do suffer from BPD have smaller amygdalas and hippocampuses than regular people. People that have suffered from BPD along with PTSD have 34% smaller amygdalas and 12% smaller hippocampuses. That's up to. And people that suffer from only BPD have up to 22% smaller amygdalas and 11% smaller hippocampuses. BPD alters the way a person thinks and feels about themselves and other people, leading to negative mismanagement of emotions and behaviors. Borderline personality rage can be unpredictable and it can be triggered by fears of being left alone and abandonment. Here we have to understand that the person perceives things usually as black and white, good and bad, friend and enemy. There is no gray in between. And that's exactly why a person could be friend or an enemy quite easily, because there is no gray in between for them generally. The next two anger disorders in the DSM are generally found in children. The first is DMDD, that stands for Disruptive Mood Dysregulation Disorder. DMDD in neuroimaging shows alterations in the right paracentral lobe, which is involved in visuospatial perception and attention, the fusiform gyrus, involved in face and object recognition, and the cerebellar culmen. People suffering from DMDD generally misperceive people's faces as angry. And now that we looked at the neuroimaging, we can start to understand a little bit of why. DMDD generally affects children, and if not treated, it could lead to anxiety and depression later on in life as they become adults. Here we also know that there's a correlation between DMDD and ADHD, that's Attention Deficit Hyperactivity Disorder. People with ADHD generally are prone towards anger outbursts and anger impulses, and this is due to poor impulse control and emotional regulation. I mean that from a neuroimaging point of view. The superior longitudinal fascialis, that's the SLF, is affected in people with ADHD. That is the white matter which connects the parts of the lateral cerebral hemisphere whose function is thought, emotion, learning, and speech control is affected in people with ADHD. The fourth and last anger disorder that we are going to be looking at, which is included in the DSM-5, is ODD, that's Oppositional Defiant Disorder. This once again affects children. Neuroimaging of people with ODD has shown the involvement of the prefrontal cortex, the amygdala, and the insula. To understand the correlation here, the prefrontal cortex modulates cognitive control, influences attention, impulse and inhibition, and cognitive flexibility. That is the ability to adapt behavior to respond accordingly to the environment. Then the second brain part is the amygdala, whose function is the detection of threats and activation of fear-related behaviors. And then we have the insula, which regulates autonomic functions such as respiration, heartbeat, and blood pressure. The insula is also involved in processing positive and negative emotions, negative being anger, fear, anxiety, and sadness. People suffering from ODD have been found to be defiant and uncooperative and even hostile towards authority figures. That includes towards teachers, parents, and maybe even their peers. Over here now, it is important to understand that most of these people have undergone treatment and therapy and are perfectly functional in society, just as a person would be with diabetes, cholesterol, or blood pressure. So please do not look at them any differently than you would a regular person. And that's it for this episode of the Wayne Lemos podcast, recorded for community and recorded for you. Do look out for the next episode where we will be discussing nutritional mentions with relation to anger. Till then, I'm your host Wayne Lemos signing off. Thank you for tuning in and goodbye.